right, folks, welcome back to your morning on Spectrum News 1. The federal government shutdown is underway beginning at midnight on the East Coast, and the Senate was unable to come to a deal last night. And it's unsure how long this stalemate could last, but federal workers are preparing for long layoffs. And joining us now is Democratic Congressman Brad Sherman, representing California's 32nd District here in parts of L.A. County. Good morning to you, Congressman. Thank you for your time. We appreciate it.
Good to be with you.
All right, so let's go here. First off, what is the point of view for House Democrats on why the Senate couldn't make a compromise, even on a stopgap funding bill?
Look, Democrats got 49% of the vote. We want to have some input into the policies that govern the nation. The one thing that we're demanding is that those on Obamacare, 22 million people, don't see their premiums double at the end of this year. We want to sit down and negotiate about that. Republicans have not made a counteroffer. They refuse to engage in any substantive discussions. This is the one thing we can do.
You know, obviously, I want to ask you about the immediate impacts of the shutdown, and then will there be more that will be added if this lasts longer than maybe folks expect?
Well, first, we've got to clarify this is only federal government. So the schools, police departments, the DMV, state and local government isn't really affected. Yes, there are some things that will get worse as things go forward. For example, nutrition programs have enough money to make it through for another week or so. After that, they're going to be impacted. If you're trying to deal with Social Security, the checks are going to go out. But if you've got a problem, you're going to be on the phone by that 800 number for a lot longer. Clinical trials are not accepting new patients. Now, if that lasts for a longer period of time, that will hurt those trials, both as to their research component and not providing a desperate chance to those who might otherwise have a disease for which there's no treatment. So a lot of these problems get worse as the shutdown continues. That's why it's so important that Republicans sit down and actually negotiate.
Yeah, we heard that the Democrats' response there moments ago were saying, you know, we would like for the House Republicans to come back, get off of vacation, and try to work this thing out. We'll see if that happens. Let's go here, Congressman. Both sides are blaming each other for the shutdowns. To be expected. Republicans are in power, but Democrats did not provide the votes needed in the Senate to pass the most recent funding bill. Is the ongoing blame game helpful for Americans? And just your thoughts on how Americans, maybe if you could, you know, speak for them, how do you think they view this, where it's just bickering back and forth, but maybe the general public is the one that pays the cost?
This country hasn't been this divided since the 1860s. Yes, Congress is divided and partisan. The country is divided and partisan. You may not realize that just being in Los Angeles, where Democrats are in the plurality, but when you look at the country as a whole, it is a very divided country. And another reason that we got here is that, yes, with a shutdown, we have dramatic action and the press is covering it. But we should have passed these appropriations bills months ago. The government has been on automatic pilot this whole fiscal year. The last time we passed laws saying what are going to be the priorities of the country was March of 2024. And so we do need more press attention on how Congress isn't getting its work done. And this has been a Republican Congress that is supposed to pass 12 appropriations bills each year. And that year ended yesterday. And because we're on a fiscal year that ends September 30th. The House of Representatives only passed 3 of those bills, and they all died in the Republican Senate. So if you don't do what you're supposed to do on time, you end up in a crisis like this.
All right, Congressman, I'll get you out of here on this one. What's the top priority for Democrats right now in their plan to make a deal, if you could pinpoint that?
Health care for 22 million Americans who are on Obamacare. And that will affect other people as well, because if people stop their health coverage, and if this doesn't go through, an awful lot of Obamacare people simply won't have health coverage. They won't pay for it. That means you have uninsured care in clogged emergency rooms, people not getting their regular care, ending up in the hospital. The hospital's dealing with uninsured patients. They can't really, as a practical matter, collect any money, and they have to pass those costs on to everybody else. So you're looking at hospitals that are in trouble, hospitals that are crowded, and 22 million people who either don't have health care or see their premiums double. We've got to prevent that, and that's our goal.
All right, well, we'll end it there. We'll have to wait and see how this all unfolds. California Congressman Brad Sherman, I appreciate your time. Thank you so much for joining us.